And as officials across the country work to speed up vaccinations, some have expressed distrust in the vaccine, and this is especially true among people of color. I recently spoke with doctors at a health center in our area about why African Americans are more at risk of getting COVID-19, where fear of the vaccine comes from, and how to solve it.
We are always at the top of the food chain for comorbidities and things that complicate our baseline health.
Dr. Myra Rutland is a nurse practitioner with Spectrum Health in Philadelphia. Most of Spectrum's patients are African Americans. According to the Centers for Disease Control, African Americans are more likely to contract, be hospitalized, and die of COVID-19. Dr. Rutland says there are several factors that play into this, one being pre-existing conditions.
When you tax the body further with a virus that has so far-reaching symptoms and stress on the body, it definitely makes it worse for African Americans.
Another factor, social disparities.
And you couple limited access to care, you couple that with the stress of, do I go to the doctor or do I take a day off work? Do I spend for medication or do I pay a bill?
These social disparities and health inequities is nothing new.
Dr. Akila Muhammad is Spectrum's chief medical officer and says that social determinant of health is another factor.
Social determinant of health affects our rates of diabetes control, our hypertension control. And now COVID, the pandemic, has actually exposed the long-seated, deep-seated inequities and social disparities that's been ongoing.
Education about the virus is what they believe is one of the key factors to solving the problem, and that includes dispelling misinformation, especially about the vaccine.
It is a safe vaccine.
Veronica Hill-Milborn is Spectrum's president and CEO. She and others have heard rumors about distrust in the vaccine, especially among African Americans.
And I think it's just the historical history of people of color being experimented on. If you think about the Tuskegee experiment, there's the distrust of the federal government. I've heard things that there is a microchip that's embedded into the vaccine, and then that's the way the government will track people. Completely false.
There's also been talk about how fast the vaccine was produced. Dr. Rutland says the answer to that is simple.
Is because there's been a need to develop this very fast. So more resources have been poured into using what we've already had at our disposal, because it's not just a few people who are affected, the whole world is affected.
And that's why they're trying to educate the community to get vaccinated.
This pandemic is affecting us more than other populations. And just for that reason alone, we should be jumping in front of lines to get vaccinated.
I want to be able to go visit and travel. And in order to do that, I need to have the immunity to be protected. And hopefully those people around me will do the same things.